Namaste Bitya. Myself JV Neha Saini from Physiotherapy and Diagnostics. Here we discuss about the anatomy of the gluteal region. The gluteal region is the transitional area between the trunk and the lower extremity. Anatomically, it is a part of a trunk. Functionally, it is a part of lower extremity. Gluteal region includes rounded posterior buttocks and laterally placed hip region. In this image, we can see the position of the gluteal region in our body. Here, the B stands for the buttocks portion, H for the hip, and T for the thigh. In the gluteal region, we have superficial fascia, which is thick, dense, well developed, and it is laden with fat, especially in women, which gives the characteristic convexity to the buttock. It forms a thick cushion over the ischial tuberosity. It contains cutaneous innervation, vessels, and lymphatics. This is the cutaneous innervation of the gluteus region. For this, we have divided the gluteal region into four quadrants. The superolateral aspect of the gluteal region is supplied by lateral cutaneous branch of iliohypogastric nerve, lateral cutaneous branch of subcostal nerve. The superomedial quadrant is supplied by the posterior rami from L1, L2, L3 and upper posterior part of S1, S2, S3. The inferior quadrant is supplied by the perforating cutaneous nerve and the lower posterior branch from posterior cutaneous nerve of the thigh. Then the inferolateral part is supplied by the branches from posterior division of lateral cutaneous nerve of the thigh. Then the cutaneous blood supply in the gluteal region is via the branches of superior and inferior gluteal arteries, and lymphatics drain into superficial inguinal group of lymph nodes. Now the fascia of the buttock region. The superficial fascia is thick, especially in women as we have discussed earlier, and the deep fascia is contiguous with the deep fascia of the thigh, that is the fascia lata. Fascia lata, it is a strong fibrous sheet that surrounds the whole of the thigh like a tight trousers, thin on its medial side while it is getting thicker on its lateral aspect to form the iliotibial tract. The iliotibial tract is demarcated in this image. It is a strong white band thickening of the deep fascia, that is the fascia lata, on the lateral side of the thigh. Above attached to the tubercle of the ilium and below it is attached to the lateral condyle of tibia. It receives the insertion of tensor fascia lata and the gluteal muscles. These are the muscles of the gluteal region, that is the maximus, gluteus medius, gluteus minimus, tensor fascia lata, piriformis, obturator internus, superior gemellus, inferior gemellus, quadratus femoris, and obturator externus. This is the gluteus maximus. It is the largest muscle in the body and forms the prominence of the buttock. It originates from the outer surface of ilium behind the posterior gluteal line. In this image, the hip bone is having the three gluteal lines, the posterior, anterior, and inferior. So, area behind the posterior gluteal line is giving origin to the gluteus maximus. It also arises from the lumbar fascia, posterior surface of sacrum and coccyx, sacrotuberous ligament. Insertion, it is inserted on the iliotibial tract. Approximately 3/4 part of the muscle is inserted into the iliotibial tract, and rest 1/4 part attaches to the gluteal tuberosity on the femur. It is supplied by inferior gluteal nerve. Now the action. It extends and laterally rotates the hip joint. It extends the knee joint through iliotibial tract. It gives simultaneous stability to the hip and the knee joints through iliotibial tract. Gluteus maximus is the chief anti-gravity muscle of the hip. It is used in standing up from a sitting position, running, and climbing upstairs. In each case, extension of the hip moves the trunk upwards. The muscle must be extremely powerful to raise the weight of the body against the gravity. This is called forced extension, which is done by the gluteus maximus. Now, the structures under the cover of gluteus maximus are the muscles which are under the cover of gluteus maximus. They are gluteus medius and minimus, rectus femoris, piriformis, obturator internus with two gemelli, quadratus femoris, obturator externus. Origin of four hamstring from ischial tuberosity. Insertion of pubic fibers of adductor magnus. The vessels include the superior gluteal vessels, inferior gluteal vessels, internal pudendal, medial femoral circumflex artery, trochanteric and cruciate anastomosis. Nerves are superior gluteal nerve, inferior gluteal nerve, sciatic nerve, posterior cutaneous nerve of the thigh, nerve to quadratus femoris, pudendal nerve, nerve to obturator internus, and the perforating cutaneous nerves. Bones and joints include the ilium, ischial tuberosity, upper end of femur, and the greater trochanter along with it, sacrum, coccyx, hip joint, and the sacroiliac joint. Ligaments include sacrotuberous, sacrospinous, and ischiofemoral ligament. The bursa are trochanteric bursa of gluteus maximus of ischial tuberosity between the gluteus maximus and vastus lateralis. Then the ligaments of gluteal region are, there are two ligaments, sacrotuberous and sacrospinous ligament. Sacrospinous ligament connects the sacrum to the ischial spine, and the sacrotuberous ligament connects the sacrum to the ischial tuberosity. And they are attached to the greater and the lesser sciatic foramina, and their main function is to stabilize the sacrum, prevent its posterior rotation at the sacroiliac joint. Now the gluteus medius. It originates from the outer surface of ilium between the middle and the posterior gluteal lines. In the diagram, we have demarcated the anterior and the posterior gluteal lines. Now, insertion, it is inserted on the lateral surface of greater trochanter. It is supplied by the superior gluteal nerve. Action, it abducts and medially rotates the thigh. It also steadies the pelvis in walking. Then the gluteus minimus. Origin is from the outer surface of ilium. Insertion is on the anterior aspect of the greater trochanter. Nerve supply is by the superior gluteal nerve. Action, abduction and medial rotation of the thigh. Then we have the tensor fascia lata. Origin is from the anterior superior iliac spine. Insertion is on the iliotibial tract. Action, it abducts and helps to stabilize and steady the hip and the knee joints by putting tension on the iliotibial band of the fascia. In the diagram, we can see the iliotibial tract. Innervation, it is supplied by the superior gluteal nerve. Now the piriformis. Origin is from the anterior surface of the sacrum between the anterior sacral foramina. Insertion is on the apex of greater trochanter. Nerve supply is by the direct branch from L5, S1 and S2. Action, it is the lateral rotator of the femur. Then another short lateral rotator include the obturator internus. It originates from the deep surface of obturator membrane and the surrounding bone part. Insertion is on the medial side of the greater trochanter above the trochanteric fossa. Nerve supply, it is by the obturator internus. Action, it is the lateral rotator of the femur. Then we have the gemelli, superior and the inferior gemelli. Origin of the superior gemella is from the external surface of the ischial spine. Inferior gemellus is from the upper aspect of the ischial tuberosity. Insertion, both the gemelli inserts into the tendon of obturator internus, and they are supplied by, superior gemelli is supplied by nerve to obturator internus, and inferior gemelli is supplied by nerve to quadratus femoris. Both are lateral rotators of the hip joint. Quadratus femoris, it is quadrangular in shape, that is why it is named as quadratus femoris. Origin, it is from the lateral border of the ischial tuberosity. Insertion is on the quadrate tubercle of the femur. Nerve supply is by the nerve to quadratus femoris. Action, it is again the short lateral rotator of the hip joint. Then we have another short lateral rotator of the hip joint is Obturator externus. It arises from the obturator membrane. Ramus of pubis and ischium. Insertion is on the trochanteric fossa on the medial aspect of the greater trochanter. It is supplied by the obturator nerve. Action is again the lateral rotator of the hip joint. Then the arteries which are supplying the gluteal region. Inferior gluteal artery. It originates from the anterior trunk of the internal iliac artery. It supplies adjacent muscles and descends through the gluteal region into the posterior thigh. Superior gluteal artery. It originates from the posterior trunk of the internal iliac artery. It divides into superficial and the deep branch. Then we have internal pudendal artery which is also supplying our gluteal region and various anastomosis over here. Then the arterial anastomosis in the gluteal region includes the cruciate anastomosis and the trochanteric anastomosis. The cruciate anastomosis is present in the lower part of the gluteal region. The arteries taking part in anastomosis are inferior gluteal artery, first perforating artery, and the lateral and medial circumflex femoral arteries. Trochanteric anastomosis, which is seen on the greater trochanter, the arteries include the anastomosis between the superior gluteal artery and the medial and the lateral circumflex femoral artery. So these are the nerves in the gluteal region which are supplying the ligaments, the muscles, and the joints of the gluteal region. Now the structures passing through greater sciatic foramen. Through the greater sciatic foramen, there is passage for piriformis, and some structures are passing above the piriformis, which includes superior gluteal nerve and the superior gluteal vessels. And the structures which are passing below the piriformis, they include inferior gluteal nerve and the vessels. Sciatic nerve, posterior cutaneous nerve of the thigh, nerve to quadratus femoris, pudendal nerve, internal pudendal vessels, nerve to obturator internus. Mnemonic for the structure is I, pin, spin. Now the structures which are passing through the lesser sciatic foramen are pudendal nerve, internal pudendal vessels, nerve to obturator internus, and tendon of obturator internus. The mnemonic for these structures is pinned. These are the structures which are passing through greater and the lesser sciatic foramen. Now the applied. Intramuscular injection is given in superolateral quadrant of the gluteal region to avoid injury to the nerves. In the image, we have demarcated the position for giving intramuscular injection. When gluteus maximus is paralyzed, the patient cannot stand up from sitting posture without support. When the gluteus medius and minimus are paralyzed, patient sways on the paralyzed side while walking. This is known as lurching gait. When bilateral, the gait is known as waddling gait. There is a sign, Trendelenburg sign, which is giving idea for the patency of the gluteus medius and the minimus. This sign shows that when the body weight is support on one limb, the glutei of the unsupported side raise the opposite side of the pelvis. If the abductor mechanism is defective, that is, if the gluteus medius and minimus they are paralyzed, the unsupported side of the pelvis drops, and this is known as positive Trendelenburg sign. This is the Bryant triangle. Supratrochanteric shortening is measured by Bryant's triangle at the hip. It is formed by a line joining the anterior superior iliac spine and the greater trochanter. Another line is perpendicular dropped from anterior superior iliac spine onto the bed as the patient lies on the couch with the pelvis square. The third line is the one that joins the greater trochanter to the second line. This line is shortened in dislocation of the hip joint, destruction of head and acetabulum, and coxa vara. This is the Nilations line. It is an again imaginary line drawn from the ischial tuberosity to the anterior superior iliac spine of the pelvis on the same side. It is positive When the greater trochanter of the femur is palpated above the line, it shows dislocated hip and the coxa vara. This is the piriformis syndrome. It is a condition which occurs when the sciatic nerve gets compressed by the piriformis muscle. This completes our topic, the gluteal region. Thank you.